of mental health, and we have questions for her. Let's take question number 6.
One thing that has come out is the mental health of people who have been presumed to be coronavirus positive. My concern is how will the community give them a sense of belonging considering the stigmatization that surrounds coronavirus?
Well, Dr. That's an interesting question. I know you have the answer for it.
Yes, that is interesting. I think if people knew that coronavirus is not an individual's illness, it's an illness that affects us as human beings, then we would be able to look at the people who are being discharged or who have been affected as people who are suffering from a disease like any other. Communities need to reintegrate the person back. Families need to reintegrate the person back without stigma or discrimination. Unless we are looking at this disease as a disease of certain people, it is a disease the way you can get cancer, the way you can get stomach ulcers or any other disease. That is what I would want the communities to know. When these people come home, they need our love. They need our integration. It's only that we are keeping distance. I could have said they need our hug. But after we are dealt with this issue, I think we all will need to be hugged by others. But for now, let's reintegrate them with love. Let's love them. They are the same people that we know and that we love.
Very interesting, and of course a befitting answer. This disease does not discriminate. And about the hugs, my producer earlier was saying, Daktari, that after the pandemic, that's Edmond Nyabola, he'll be hugging everyone 10 times over just to compensate. All right, question number 7.
My name is Mutai Baxton. I stay in Nairobi. My first question is, at what point in time is stress in an individual declared a mental health problem? And how can the same be managed? My second question is, I'm told that some stress is beneficial. How is this possible? And how does one get to know whether the stress at hand is beneficial or not?
I've never heard of that, Daktari, beneficial stress, but tell us about it.
Thank you, Mutai, for that question. Yes, there is beneficial stress. We call it eustress. This is something that motivates us to do the things. If, Ken, you are not stressed that you have to go to studio this evening, sometimes you may just sleep and feel like you're not obligated to go. But that eustress helps us to be able to perform what we are supposed to do. So that is good stress, Mutai. Then there is the bad stress, what we call the distress. Distress can harm. You have asked at what level does it become a mental health issue? If it is affecting you, whether psychologically or physically, that is a mental health issue. What do I mean by that? If this stress, like Ken had asked whether sleep is a mental health issue, if it can make you not sleep, then it is distress. If it makes you start developing high blood pressure or diabetes or other health issues, it is distress and it is a mental health issue. It needs to be dealt with. So stress, when it incapacitates you or makes you not able to do what you're supposed to do, it becomes a mental health issue. How do you manage it? There are several ways that you can manage stress. One of the simplest that I want to advise people to do, keep doing exercises, talking to loved ones, do things that give you positive energy and that make your life look exciting. Those are some of the things that will help you. Give yourself rest. Eat right. Do not run for the refined sugars and junk food. Eat right and be able to have things that can protect you from developing distress as a mental health issue.
And at the end of the day, if those don't achieve your success, what would you advise, Daktari? If you don't get success from your advices?
Yes, if those don't work, please see a mental health practitioner. A psychologist will be able to help you. If the psychologist sees it's beyond what you can handle by psychotherapy, they will be able to refer you to a medical doctor, most preferably a psychiatrist, who will be able to prescribe some psychotropic medication to help you calm down, and as the psychologist is supporting you.
Very, very comprehensive indeed. I want to thank you for your time, Dr. Charity Waithima, clinical psychologist, assistant professor of psychology at the USIU Africa University, also a practicing therapist. Thank you for your answers, and I bet all of them have been answered and your concerns have been taken care of. Time now for